Heart disease is the leading cause of death for both men and women worldwide. The best way to prevent heart disease is to take good care of your heart. To stay fit and healthy, here are 9 key tips to improve your heart so it works more efficiently. 1. Avoid overconsumption of food. Excessive consumption of foods, especially salty, sweet and fatty diets, can lead to an increased risk of developing heart disease. Studies show that certain diets that are high in fat and cholesterol significantly increase the risk of cardiovascular diseases, such as atherosclerosis, a disorder in which the arteries can lose their elasticity. The recommended ratio is 6:6:1, which represents less than 6 teaspoons of sugar, less than 6 teaspoons of fat and limited to 1 teaspoon of salt. 2. Eat more whole grains. High intake of whole grains is strongly associated with a lower risk of heart disease and hypertension. Several nutrients found in whole grains have known potential mechanisms for reducing heart disease risk factors, e.g. linoleic acid, dietary fiber, vitamin E, selenium, and folate. Whole grains also contain phytoestrogens and some phenolic acids with antioxidant properties. In addition to controlling blood lipid levels, e.g. cholesterol, whole grains help reduce blood sugar levels, leading to a reduced risk of diabetes. 3. Avoid strenuous exercise. According to the American Heart Association, exercising for 30 minutes a day, 5 days a week, improves heart health and reduces the risk of heart disease. However, in patients diagnosed with heart disease, strenuous or extreme exercise and activities should be strictly avoided. Prolonged strenuous exercise stimulates the heart to work harder and it can increase the risk of abnormal rhythms, such as atrial fibrillation, which is characterized by a rapid and irregular beating of the heart's atrial chambers. In healthy people, fat-burning exercises such as running, walking, cycling and swimming are recommended. 4. Get enough sleep with a proper bedtime. Sleep is essential for a healthy heart. People who do not get enough sleep are at higher risk of cardiovascular disease regardless of other factors, such as weight, age, smoking, and exercise habits. Over time, this can lead to higher blood pressure during the day and a greater chance of cardiovascular problems. Researchers have also found that getting at least 6 to 8 hours of sleep each night can reduce the risk of heart disease and other health problems. More importantly, to achieve a healthy sleep pattern, the appropriate bedtime is before midnight. 5. Wearing a smartwatch to monitor heart health. Recent studies have shown the effectiveness of wearable devices such as smartwatches in improving the screening and detection of heart diseases, such as atrial fibrillation. Mobile health technologies such as smartwatches, fitness trackers and other phone applications have the ability to monitor heart rhythms during daily activities and enhance the detection of heart disease, leading to early diagnosis by expert cardiologists. For example, advanced medical technology is being designed and used in hospitals. For example, Health apps connected to hospital systems that allow doctors and other healthcare workers to monitor the health status of patients, especially in emergencies. 6. Travel often with active movement. Traveling, especially in nature with fresh air, plays a role in improving heart health because higher oxygen levels allow the heart to work more efficiently. In addition, gentle hiking with appropriate distance promotes physical movement and physical fitness. 7. Quit smoking. The chemicals in cigarettes cause the blood to thicken and form clots inside the veins and arteries. Blockages from blood clots can lead to heart attacks and sudden death. Smoking also damages the lining of the arteries, causing a buildup of fatty material that narrows the arteries. When the arteries tighten, it makes the heart work harder. Smoking can also cause irregular heartbeats and high blood pressure, which are leading causes of other serious health problems, such as stroke. The best way to reduce your chances of heart disease and other health conditions is to quit smoking before it is too late, when the diseases have developed and progressed. 8. Seek genetic screening if there is a family history of heart disease. Genetic testing for inherited heart disease can primarily predict the risks of developing heart disease associated with gene mutations in patients with a family history of inherited heart disease. The standard recommendation is to continue regular annual screening, especially in those over 40 years of age. If any unusual signs or symptoms are present, immediate medical attention should be sought as soon as possible for accurate diagnosis and effective treatment. 9. Exercise programs suitable for patients with heart disease. Some heart disease patients may not know which exercise programs are right for them. Cardiac rehabilitation is a medically supervised program provided by cardiac rehabilitation physicians, physical therapists, and other healthcare providers who specialize in cardiac rehabilitation. Cardiac rehabilitation programs are specifically designed to improve heart health after a patient has had a heart condition such as a heart attack, heart failure, or open heart surgery. Programs are determined by the severity of the condition, the long-term impact of the condition, and the overall health of each patient.